And this week we're going to be talking about mental health practices for individuals with MCI with Jocelyn Chen Wise, who is a social worker who comes to us from the Fuqua Center for Late Life Depression. And she's the program director there, a nonprofit organization here at Emory that is dedicated to increasing awareness and access to mental health treatment. And one of the goals that the Fuqua Center has is to eliminate the stigma and the discrimination that is experienced by older adults that may struggle with mental health issues. As you guys all know, if you've tuned into some of our sessions, one of the things that we are also interested in is lifting that stigma and having these conversations. And the Fuqua Center has a long history of these collaborations. Jocelyn's work is really about bringing mental health care to vulnerable populations. And she works a lot in residential environments, but she's also really going to be pulling some of her specializations from late life issues like caregiving, grief and loss, adjustment to life transitions. And we're really excited to have her with us this week. I'm going to go ahead and let her get started with her session. But if you have any questions or you want to reach our staff here, I'll put this in the chat in a moment as well. You can always email us at outreach@empowerment emory.edu. So feel free if you have any comments or any suggestions that you want to offer to send them to that email address where you can also reach any of our staff members. So Jocelyn, welcome in this week. Thanks so much for joining us today. I'll let you go ahead and pull up your slides and talk a little bit maybe about why this is a good conversation for some of the people who may be experiencing life after a big diagnosis like this in our community.
Absolutely. Thank you so much for inviting me to be part of our program today. And I'm such a big fan of CEP, have lots of colleagues who are familiar with it, and I just have such respect for the work that you do. So I really appreciate you pulling me in on this topic. And Megan, you're absolutely right. You know, emotional well-being is a huge part of what matters to the work that I do in geriatric psychiatry for folks who provide mental health services. You know, we know that as people are living longer, we're seeing more folks with mild cognitive impairment and want to be aware and able to support folks in that journey. So this very much overlaps with some of the things that I care about the most. I think my goal for this presentation is to help people feel a little bit less lost in the process, kind of have a little more sense of where they might be, what options there are for getting more help and support, and feeling less alone in the process, which, you know, you're already talking about. Um, and there's lots of terminology that we use that can be a little confusing for folks. You know, if you're trying to seek care, is it from a psychologist or a psychiatrist? Is it, what are we talking about when we talk about mental health? So I'm hoping that we'll just spend a little time making that part a little less murky. Um, but I called this presentation Emotional Well-Being because I think that's kind of the goal we're all aiming for, that whatever life is throwing at us, that we're focusing on doing our best with that and maintaining the best life we can. And there's, you know, really from my perspective, there's no way of doing that without paying some attention to our mental health and emotional health. So, you know, again, a murky kind of idea, but I'm hoping that this little depiction here helps us think about what are the pieces that we're talking about when we think about well-being. And I really like to think about well-being as a balance of our mind, body, and spirit, right? So our mind, when we talk about that, might be learning about our thinking and our emotions. And a lot of times folks are surprised to learn that these two things are different, that my thoughts are different than my emotions, which are also different than my behaviors. And that even though this stuff shows up pretty automatically, we can become more mindful, we can become more knowledgeable about ourselves and use tools to manage the thoughts that are coming up, to manage the emotions that are showing up, and to make sure our behaviors are lining up with the kind of person we want to be. This is particularly important, I think, when there's a big new diagnosis or a big change in your life. So really that mind part is so important to having some self-knowledge. And then, of course, our body, right? There's been a shift over the last few decades where we're acknowledging that our brain is part of our body, that our brain, it's not like from the neck up and neck down are separate. These things are connected. So the mind-body connection is something that people might hear about. And taking care of your body, taking care of your physical needs has benefits for your mind and vice versa. And then the spirit, right? We don't want to forget that humans are not just, biology. There's a spiritual piece to being a human. And I like thinking about spirituality as connecting to something larger than ourselves, right? So spirit, that connection could be to community. It could be to nature. It could be to art and beauty. It could be to family or to a religious organization. But there's lots of ways that people can feel connected and spiritually healthy. So a lot of my work is trying to help people find a balance between mind, body, and spirit, which I want to instill some hope. That is very possible, even with a diagnosis of early dementia or mild cognitive impairment. And we'll talk a little bit more about that. Sorry, there we go. All right, so common neuropsychiatric symptoms. So frequently, people aren't sure if what is showing up is related to a change in mood or to a new diagnosis of MCI. So I wanted to talk through just kind of the top 4 neuropsychiatric symptom categories that you might see. And there's lots of things that, can happen to folks with the disease process. These are some of the most common. And I wanted to talk through some of the symptoms that you might see. Of course, this is going to be different from person to person. There's no, exact roadmap for what might show up in terms of symptoms. But I'm hoping that if we talk about the sort of top 4 most common symptom areas, this might give some clarity. So depression, one of the most common conditions you see in any population. It's just a very common condition among adults of all ages. And what that can look like is any constellation of different symptoms. So I'm going to go over some of what's here. And for folks who are experiencing severe depression, you might see a lot of these symptoms. For folks who are experiencing mild depression, you might see 1 or 2. But I'm going to put these out here because I want folks to know a little bit about what that can look like. You'll also notice that depression and anxiety, there's some overlapping symptoms. So we'll talk through that in a moment. But depression, again, can be on a spectrum, mild symptoms to severe. Severe depression can be very impairing. Mild depression is also something we don't want to ignore. But there is kind of a range of intensity of symptoms people might feel and a range of impacts it might have on your life. Kind of a classic depression symptom is sadness. But what some other folks don't think about as much or notice is that another core symptom of depression is a loss of interest. So there are some folks who actually have depression without really that feeling of sadness. It's more of that like, blah, I just am not interested, can't be bothered, and much of anything. That still meets criteria for one of the core symptoms of depression. You may also see irritability. So people who are just way more edgy and things that used to not bother them are bothering them now. More frustration, restlessness, and that might be sort of a physical restlessness that you feel, or more of like an emotional restlessness. Changes in appetite, which might mean eating too much or too little. Weight changes in terms of losing weight or gaining weight. Sleep disturbances, sleeping too much, or sleeping kind of having poor quality sleep. Fatigue, trouble concentrating, feeling hopeless, and negative thinking. All of these can kind of make up some combination of these symptoms might make up a depressive episode or a depressive disorder. Relatedly, anxiety. Anxiety, again, among just a regular adult general population, very common condition. It's actually even more common than depression among the general population. And we all have anxiety, right? Everyone has anxiety as a regular human emotion. But when anxiety starts to become a problem is when it gets in the way of living your life the way you want to. So with an anxiety disorder, you might be seeing excessive worry, difficulty concentrating, again, sleep disturbances, an increased heart rate. There can be a lot of somatic symptoms that come with anxiety, meaning I feel jumpy, I feel hot, I feel sweaty. There's a lot of body symptoms I might feel. Trembling, or a sense that something bad is going to happen. So some kind of like a looming feeling that something is negative or terrible is going to happen, even if you don't know exactly what it is. And then the last two most common things that we're seeing in terms of neuropsychiatric symptoms, apathy. And this one is not talked about as much, but apathy is something that can show up with mild cognitive impairment or early dementia, where you're seeing kind of, again, that lack of interest or enthusiasm, just no thanks, can't be bothered. Emotional blunting, so less reactions, less sort of highs and lows in emotions. And with that can come social withdrawal. So apathy can be a really challenging early symptom of MCI. And then irritability. So again, you know, there's a bit of overlap between depression and anxiety, and all of these conditions. But irritability, you might see a change in the ability of someone to tolerate frustration, increased sensitivity, jumpiness, restlessness, outbursts of anger. And that is a mood symptom that is worth noticing. How can we get help with these symptoms? All right, so I know a lot of the material that CEP puts out has to do with helping people cope with the stuff that can show up around a diagnosis. So some of this is going to feel really familiar, but structure is quite important for maintaining our mood and improving our mood. And then I'm going to talk a bit more about mental health treatments, but I wanted to give kind of this overview of ways that we can be thinking about building wellness into our emotional health. So having structured, meaningful activities on a regular basis can be really important for depression, for anxiety, for irritability or apathy, because we're less likely to seek those things when we're experiencing neuropsychiatric symptoms. So really having something built into your week where you're going somewhere positive or pleasant, where you're having social interactions, and when you're getting mentally stimulated, that's, I'm sure, a very common theme in a lot of the CEP work. But thinking about it in terms of emotional wellness is just as important. Caring for your body. I underline sleep because sleep is just such an incredibly important piece of managing mood. I know that if I've gone a night with poor sleep or a few nights with poor sleep, I'm much more irritable. I'm thinking less clearly. I'm probably more anxious, and I just feel generally uncomfortable. So finding ways to regulate sleep can be actually a very important part of mental health. I can't also tell you how many of my patients, once they've gotten their sleep apnea diagnosed and treated, see an increase in their improvement in their mood and their clarity of thought. So if there's any suspicion that you have anything obstructing your sleep that needs a sleep assessment, I would say run, don't walk to get that assessment. And there are so many modern day treatments that are helpful for sleep apnea. Um, Physicians in my clinic have also emphasized that treating sleep apnea is one of the most neuroprotective things that we can do because, if you think about your brain getting oxygen every single night that we sleep, it is so, so important to brain health to make sure that that's happening. So that's my pitch on sleep, just so, so important. But also movement, right? A really important way of regulating our mood is to get access to sunlight and to physical activity. Moving our bodies in any way is going to be important for mood. I know it feels counterintuitive that when you're down, depressed, anxious, or irritable, that moving your body may be the last thing you want to do. But almost always you see improvements in regulation of emotions with movement and nutrition. Of course, what we eat and how often and regular meals makes such a big difference in how we feel. So again, this mind-body connection of if I'm uh, if I'm hungry, I am just going to be so much more irritable. I'm going to be more anxious. If I'm not having nutrient-dense meals, I'm going to potentially be kind of experiencing ups and downs in my blood sugar. So just paying attention to nutrition. You don't have to have a perfect diet, but just make sure that nutrition is um, a priority. And then I'm going to spend more of the rest of this presentation talking about mental health services. So talking to a professional therapist or a counselor can certainly be helpful for someone who's gotten a new diagnosis, doesn't know what to make of this, needs help and support as they think things through, as they take stock of their life. And then medication, so sometimes that's the first line where people are saying, I'm depressed, I'm anxious, I'm irritable. You may be kind of moving quickly to medication. And I have seen it be very helpful for some people and not so much for other folks. There's some people who say, that's not for me. I don't want to go down that road. I'm already taking enough medication. And that's okay. I think depending on the severity of your symptoms, you may not need to go that route immediately. But I do want folks to consider that in terms of psychiatric medications, we have so many more than we did in the past. There's a lot more medications without a lot of side effects, medications that can be taken in combination with other things that folks are taking safely. And so not to be afraid to explore medication as a possible really important step to improving mental health. How is talk therapy useful for someone with MCI? Sometimes I get this question of, is talk therapy useful for someone with MCI? And the research shows that it can be. And I am also a therapist, and so I do therapy with folks who have MCI. We'll get to this sort of towards the bottom. Sometimes you do have to modify how you do mental health counseling or therapy for someone who has a mild memory impairment. But there's certainly research showing that traditional supportive or cognitive behavioral therapy can be helpful for managing the symptoms of depression or anxiety or just the stress of having a new life change or a health issue. Part of what you can do in therapy is also identify triggers, right? So if you're noticing that there are things that are triggering episodes of high anxiety or irritability, that's one thing that we can explore in therapy to help make changes in your environment or in your schedule or in your day so that you're not experiencing as much triggering things that trigger those more difficult depressive or anxious emotions. Um, Improving quality of life is a big part of what you can work on over time with someone as a therapist. Finding ways to connect to your values. What do I care about? What's meaningful to me at this point in my life as an adult? Sometimes we don't really stop and explore that. And that's one of my favorite things to do as a therapist is to help learn about that person, what it is that makes up their personal value system, What are things that are meaningful to them that have maybe been meaningful to them for their whole life? And how do we get more of that into your life? Even with MCI, even with early Alzheimer's, it's oftentimes quite possible to find ways of tapping into people's values and making sure that at this phase of your life, you're still doing things that are important to you and bring a sense of meaning to your life. And then coping strategies. So the next slide, I stole a slide from Debbie Arnold, which I thought was a really nice depiction of different coping strategies. But with any stressful experience, we want to have some tools in the toolkit for how do I regulate my emotions? How do I understand what's showing up in my thinking? And that oftentimes gives people more of a sense of control, right? There's a lot of things that show up automatically, but we also have to build in a toolkit that gives us a sense of like, I know what to do with this, or I have some options when I'm feeling anxious, when I'm feeling irritable or down. And then a lot of, I think a lot of what CEP does is enhance social support. And that is so important when you might be feeling quite alone in this journey. And, part of therapy can be exploring how do I increase my social connections? How do I build that more into my schedule? And how do I take small steps in that direction? I mentioned a moment ago that sometimes you want to modify the way that you do psychotherapy, talk therapy with someone who has MCI. And that might mean breaking things into smaller pieces, making things simpler, so that you're not layering concept after concept after concept. You're kind of keeping things cleaner. Repetition, a lot of, revisiting things, coming back to different concepts so you can keep learning different ways of applying it in your life. Using external memory aids. So if you have a very visual learner, using visual pieces, using calendars, using, ways of writing things down to help with memory. Reminiscence therapy. I really love reminiscence therapy as a way of getting to know somebody. And I think people with MCI especially need to feel seen. They need to feel understood as a whole person in their work in therapy. And so I really like reminiscence therapy as part of that. And then maybe more so than you would see with someone who has no cognitive impairment, you're going to be pulling in care partners or caregivers into some of the therapeutic processes. So, working with someone early on and saying, is it okay if I include your partner in some of our discussions, just to make sure that some of what we've talked about can show up and get implemented in your life. So this is the slide that I stole from Debbie Arnold, but I really like this idea of 3 domains of coping that we want to be paying attention to: emotional issues, practical coping, like using assistive technology, making sure that we take advantage of different methods to make things easier for folks. And then lifestyle changes. So, a lot of times thinking through, how do I plan for my future now that I have this diagnosis? What do I need to change or prepare for in a very practical lifestyle way, and making sure that people feel like they're not alone in that process. Frequently, when I work with someone with an MCI diagnosis, the questions come down to, what does this mean for me? Right? Now that I have this diagnosis, I've seen the testing, I see the results. What does that mean? Right? How do I live my life the best I can with MCI? And there's oftentimes, a process of coming to some acceptance around that diagnosis. There can be a lot of grief and a lot of confusion in the beginning, but at some point, someone is going to come to this place of, now what, right? And that's where a therapist can be really helpful. How do I live my best with MCI? What changes and what stays the same? So sometimes people with MCI kind of assume that everything is gone, but that's not always the case. Oftentimes, a lot stays the same, and there are adjustments and new strategies that need to be put into place, but there's a lot of things that remain. So I really like exploring this kind of issue with people where they're making life transitions. Okay, and then here's my very practical piece of the presentation, which is making some sense of how do I get help, right? So the top section here is more going to be focused on how do I get a diagnosis, evaluation, and the potential of starting medication. So you would need to see a medical provider for getting started in that process. So let's say you have some signs of depression. You could start with your primary care doctor. A lot of primary care doctors are very familiar with basic antidepressants. That's going to be things like Prozac, Lexapro, Paxil, and they're comfortable treating depressive symptoms. A psychiatrist is going to be more of an expert or specialist in mood, so they can treat a wide range of issues that are showing up in terms of mental health. They're also going to be probably more comfortable and familiar with an even larger range of medications. So you're going to end up seeing either an MD, a DO, or a nurse practitioner, advanced practice nurse. They're going to do an evaluation, and then they're going to kind of talk to you probably about, do you want to start medication? And that's a great chance to ask questions, kind of figure out how this might work or not work for you. Same with anxiety and irritability. A lot of these medications kind of treat um, a variety of things. So sometimes people are concerned that I'll be put on something addictive. You can talk to your prescriber, but I don't want to be put on something addictive or sedating, right? So there's a lot of options out there that are not habit forming and also not sedating. And there's lots of ways of kind of dosing things, taking things at different times of day, splitting doses. It's a very, it's an artful kind of part of medicine. Um, so that's the medication piece and sort of more of the medical side. What if you want to see a talk therapist? Talk therapists have lots of different credentials. So they're psychologists, and that can come with a PhD or a PsyD after their name. There's licensed marriage and family therapists, LMFTs. There's licensed professional counselors, LPCs. There's licensed clinical social workers like me, LCSWs. And there's a few more in the alphabet soup, but these are kind of the most common credentials you're going to see when you're looking for a therapist. Um, and in a moment, I'm going to give you some specific places you can look to find a therapist. But I'm also going to say right now that don't forget about support groups. I have facilitated support groups for different diseases in the past, and it is so beautiful to see strangers come together who then become friends, who become a real community to each other because they're walking the same path or a similar path. And they can really provide support in a way that is special because they're living it. So support groups, wonderfully powerful, not exactly the same thing as therapy, but can be really useful. Group therapy is going to be a bit more structured than a support group. It's going to be more focused on probably mental health skills and coping skills and specific things to manage depression, anxiety, mood issues. That that is another area of therapy or psychotherapy that you can think about. I'll say more about this later, but there are intensive outpatient programs, which are usually time limited. You know, you might be in them for 5 weeks, 6 weeks. And the intensive part means that you're going to therapy multiple times a week. So it could be 3 days a week, 2 days a week, could be 5 days a week. I'm going to speak a little bit more about Emory's program for that. And then there's traditional one-on-one counseling, and there's couples counseling. Since the pandemic, there's a tremendous amount of teletherapy that's available these days. Most therapists leaned way into teletherapy during the pandemic, and then it stuck because it's quite convenient for a lot of people. So there's some people who do it in person, but there's a lot of folks who are doing it telemedicine, and that's been helpful for folks who live in areas where there maybe aren't a lot of mental health resources or it's very difficult to get out of the house. So just keep in mind that these days there's quite a lot of teletherapy. And then couples counseling. I do think particularly when MCI or early dementia is involved, it can be really powerful to do therapy as a couple, because you're taking into account the experience of both people. And oftentimes it helps to have a third party who's really there to support the both of you and sees the family as the unit. How do you find a therapist? One of the biggest databases that exists out there is Psychology Today. If you've ever Googled a therapist, something from Psychology Today probably came up. It's this huge database. I think the American Psychological Association links to it as well. There's lots of ways to search for a therapist. The easiest way is to start with your city or your zip code. So you can look geographically. But then there's also all these drop-down menus of ways to narrow down someone by the insurance that you have, maybe the issues that you want to work on. You can even look at, what gender of therapist am I going to feel more comfortable with? So I really encourage people to shop for a therapist. Don't feel like there's the best therapist out there. There's the best therapist for you. I always say finding a therapist is a little bit like dating, like someone who I think is good for you is only good for you if you think so too, right? So it's okay to start with a therapist, give them a few sessions, and if it's not clicking for you, it's okay to move on and to try to find someone who you have a better rapport with. I also mentioned intensive outpatient programs. Emory has a long-running outpatient program called Emory Transitions. Used to be at Emory Wesley Woods, but it's in the last year moved to Emory Decatur, which is the old DeKalb Medical Center that Emory has now taken over. This is the website where you can look at their different programs. This is the phone number to call a very helpful intake person. And you can even send them an email if you're trying to get some more information. I think this is the most up-to-date information. These things changed a little bit over time, but what you're going to get at the transitions program is mainly group therapy. So it's largely group with some individual therapy and also medication management. And I really love this program because it is trying to be more comprehensive. There is a partial hospitalization program for seniors, so people 60 and over. That's 5 days a week. Even though that name has hospitalization in it, you're not hospitalized. It's just sort of an old-timey sort of Medicare term, but what it means is that it's intensive. You're going 5 days a week. The program happens to be at the hospital, but you go home. And I really like our program because it includes transportation and it includes lunch. And for folks who have Medicare, Medicare usually covers about 80% of it. And then if you have a supplemental insurance, that covers the other 20%. There's also 2 adult intensive outpatient programs, which are 3 days a week, not 5 days a week. And they're a little bit less, the sessions are shorter. And they have also a young adult intensive outpatient program, which is more for people aged 18 to 28, sort of late teens to college age or grad student age. Before we wrap up, and I'm getting close, there are some red flags. If you see sudden changes in cognitive status over a few days, right? So this is not over months or years that you're seeing a change in somebody's cognition. They may have delirium, and you may want to immediately move towards getting medical care. Delirium is something that frequently happens with UTIs. So somebody who might have an infection, pneumonia, UTI, suddenly is starting to seem very confused, agitated, or the opposite, sort of this waxing and waning of their attention. I want you to suspect delirium and very quickly go get some blood testing, urine testing, to see if there's something changing. So that is not something you should wait on or to try to get therapy for. That's something you go to the hospital or immediately go see, urgent care or primary care doctor. Same with suicidality. That is not something that we want to wait on. If someone is feeling suicidal and is saying, I think I'm going to take my life, I don't want to live, then that is a medical emergency, and that is a perfectly okay situation to take someone to the ER or to call 911 and get some help with that situation. or if someone becomes violent. So if any of these things are happening, these are red flags that it's not time to seek, regular outpatient care. It's time to be more urgent. Emergency treatment, like I just mentioned, you can call 911. You can also call 988, which is the new number that is for mental health emergencies. And that should connect you quickly to somebody who can help you figure out next steps. It's also perfectly okay to take someone to the hospital or the emergency room and say, these are my concerns. I need some help immediately. And that is it. I'm trying to keep this as short and sweet as possible. This is my contact information. I thank you so much for your attention